Hello, my name is Dr. David Morris. I'm glad you're taking the time to watch this video. I know it will answer a lot of questions for those people suffering with diabetes, prediabetes, or insulin resistance, and really other metabolic issues. Something that we're very proud of is that our approach to complex metabolic issues like diabetes has been so successful that we've had to expand our team to help patients. So while it is me doing this presentation, our team and our team approach is the reason for our success in helping people get their lives back. Please watch this video all the way to the end. I know it is a little long, but all of this information is important to solving these issues. Okay, before we get started, a couple of important housekeeping items. The main one is put your phone away or turn off the TV and really do your best to pay attention to this information. I know how distracting life can be, especially with the internet, but this information can change your life, and you owe it to yourself and maybe your loved ones to devote the next 60 minutes or so to getting the information that can change your life. It's worth 60 minutes or so to fix this problem and get your answers. The other housekeeping item is to grab your significant other and make them watch this with you. If you're serious about reversing this condition, have your special person watch this with you. They need to understand the condition and what can be done about it. In my clinic, we specialize in treating chronic illnesses, of which diabetes is among the most common things that we see. It's estimated that over 100 million Americans are diagnosed with either diabetes or prediabetes, and those numbers are going up every year. Another alarming estimate is that there's another 50 million more that have not yet been diagnosed. This means that nearly half of our entire population either has or is suspected to have blood sugar issues. So we're going to get started. I want you to understand that we're going to be going over a lot of different material here today. At the very end of this video, I'm going to give you the secret to what you can do to actually take care of this problem if you have it or if you suspect you have it. So again, watch this all the way to the end. Don't stop halfway through and call the office and say you want an appointment. Watch the whole thing. It's very important. Just a little bit about me. I'm a chiropractic physician in my clinic. I've been in practice for 28 years. However, our office is a medical clinic. It's not a chiropractic clinic. We have medical providers specializing in functional medicine and functional neurology. We use those two disciplines in treating chronic disorders, and you're going to have a clear understanding of what that's all about after you watch this video. This information is information that has helped thousands of people. Most of them very frustrated and desperate, trying to figure out how to improve their numbers and get healthier, and they're just not seeing results with everything that they were doing. We have a very high success rate, which we're very proud of, helping patients reverse type 2 diabetes, not manage it, not control it, actually reversing type 2 diabetes, and that's what I'm going to go over today. Now, something you want to understand is that all chronic health conditions have common threads. And before I even get into that, what this condition entails, I'm going to cover a topic which I'm very passionate about, and that is the condition of our healthcare system. I've asked over 10,000 people if they think our healthcare system is broken, and 100% of them say absolutely yes. Well, I want you to understand that our healthcare system, our traditional medicine, is very, very good at acute problems and keeping you alive. Like if you have an infection or a broken bone or you get in a car accident. I tell our patients all the time, if you get in a car accident or have a heart attack, make sure you do it in the United States because we're good at that. Where a healthcare system and where traditional medicine really, really falls short is in handling chronic conditions. Now, some people watching this already know that because you've been through many doctors, or maybe you've been going to your endocrinologist, or you've been going to your PCP, and your sugars are not resolving. It's because the way our system treats chronic conditions. You have to understand that our healthcare system is very pharmaceutically driven. Now, if you don't believe me, just turn on the TV later, and I guarantee you'll see some kind of commercial that for a medication that you can take for a chronic problem. It's very pharmaceutically driven, and therefore, almost all medical doctors, medication is the answer and the only answer to any chronic condition. That doesn't actually make a lot of sense, but that's the way it is. I've asked a lot of patients, think of two things that you can do that would make you healthier. No one ever answers, take more medications. So you cannot medicate yourself out of a chronic condition. You need to understand that. You need to get to the root causes. You're going to understand after watching this video that there are multiple pieces to the diabetes dilemma, and your endocrinologist or your primary care doctor is only addressing one, maybe two. So continue watching and see what those pieces are. That is what we do in our clinic. We get people's lives back. All right? So we've heard so many people come to us and they start out skeptical. I get it. They say, you know, if you're getting these great results, why aren't they applying this method of treatment and helping patients the way you are? That's a really good question. That's a question we're going to answer today, and that's a question you should be asking yourself and even asking your doctor. Now listen, our healthcare system, like I said, is pharmaceutically driven, and the insurance companies like Cigna, Medicare, Blue Cross, whoever you have, they are also tied to the pharmaceutical companies. The pharmaceutical companies and the insurance companies, they're in bed together. I'm sure you already know that. The pharmaceutical companies are largely calling the shots. There's an old saying, he who pays the piper is apt to call the tune. So pharmaceutical companies have done a wonderful job at entrenching themselves and really ruling our healthcare system. However, as I said, pharmaceuticals don't correct chronic conditions. They only manage them. So a lot of times people come to us and they're seeing a doctor because they're on their insurance plan, and they wonder why their doctor's not doing all the testing, not following up properly, or explaining things to them. Folks, you got to understand the economics behind all this for your doctor. Now, I'm not making excuses for them, but he or she is stuck in a broken system. As an example, we work with Blue Cross Blue Shield. Now, we get reimbursed less now for a visit right now in the year 2024 than I did in 1997 when I started practice. We get less now. You better believe that our overhead is higher now than it was back in 1997. So what does that mean economically? If we're doing an insurance-only type practice here, that would mean that we would need to see a lot more patients now than we did in 1997 to produce the same amount of income. You experience the effect of this when you go to your doctor. Short 5 to 8 minute visits. They don't explain anything. They don't have time. They'd go bankrupt. They're stuck in an insurance-based model. So here's something I'm going to tell you. Don't shoot the messenger. It's the truth. If you want quality health care for your chronic condition, you're going to have to think outside of your insurance plan. You're going to have to dig into your pockets and pay for it. And why shouldn't you? What is more important than your health? Your health insurance doesn't pay for your car, doesn't pay for your home, doesn't pay for your clothes, for your trips, for your cell phone, for your meals out, yet you pay for those things. Why wouldn't you pay for quality health care out of your own pocket? This is so true, especially with blood sugar conditions. Look, no one wants to go spend money on a doctor. No one's ever said, I would like to go to the doctor and spend money. Yet that might be needed if you want to fix a chronic condition. Look, we see a lot of chronic cases in my practice, but diabetes patients, they come and they say, Dr. Morris, I've been going to this endocrinologist for 15 years, and I feel worse now than 15 years ago when I started. My question is, why are you still going to him or her? And they're like, well, you know, they're on my insurance plan. My insurance covers it, blah, blah, blah. Really? Would you go to a restaurant every night of the week for 15 years and eat food that made you sick? But hey, it's free. Or would you rather pay for a quality meal? Listen, don't skimp on your health. I'm just telling you the upfront truth. If you want quality health care for a chronic condition, you're going to have to pay for it. Our patients are happy to pay us. I go over the cost for our care at the end of this video, and our patients pay us good money to see us and get better, and every one of them, you can watch some of the testimonials, say it's the best money they ever spent because they got their lives back. A patient once told me they were coming to us to get proper care. I thought that was interesting. They said when they go to their doctor, they pay a $25 copay, but they're only getting $25 care. And I thought that's a great way of putting it. So you need to understand how the system works, and that's why I'm sharing that with you. Okay? Now, patients very often feel desperate or frustrated. You're going to the doctor. You're taking your medication as prescribed. You've been to a nutritionist or a dietitian. You're still not seeing long-term improvement. The frustration and desperation can set in when you feel like you're doing everything you've been told to do without success. And that's exactly the point where many of our patients come to see us. They have their endocrinologist, their primary care doctor, and they have their medications. And they even go to weight loss clinics, and many of them do everything they are told to do. But everything keeps going in the wrong direction, so they come into our office for the first consultation, and many of them don't feel like there's anything we can do to help them, but they often say, what do I have to lose? Then we help them and we hear, I'm no longer on my diabetes medication, off blood pressure medication, no more injections, all within months. This is a life-saving program. We have so many patients that were on insulin and have progressed to the point of injecting multiple times a day. We help them reduce and eliminate medication. We see patients lose weight even without exercising. We see patients that have better sleep. So many patients come in with horrible sleep patterns and inability to sleep or stay asleep. They feel better. They function better. When you're feeling better, you participate more and your quality of life improves. We've seen so many patients that are able to do things that they always had on their bucket list to do, but didn't really feel like they could do it. And at the end of the day, what patients really do is get control over their health instead of feeling their health is controlling them. Now, when we initially sit down with patients, and we've sat down with so many patients over the years, we hear a very similar story over and over. And what we typically hear is that before someone is ever diagnosed as a type 2 diabetic, most patients tell us that they did not have any symptoms of a disease at all. They just went to their doctor office one day for a routine physical or something, and the doctor ordered routine blood work. The doctor looked at the results, and that's when they get the news, and the doctor tells you, you're a type 2 diabetic. No sooner is a doctor getting those words out of their mouth, you're a diabetic, they're reaching for a prescription pad, and they're writing you a prescription. 9 times out of 10, that prescription is going to be for metformin. I'm sure you're familiar with it, and maybe even take it daily now. It's the most commonly prescribed type 2 diabetic drug out there on the market. So the doctor says, Ms. Smith, we're going to prescribe 1,000 milligrams, so take 500 in the morning, 500 at night, and then typically they start heading for the door, right? So they might tell you to go change your diet. They might say lose weight, exercise. Maybe you're referred to a diabetic educator or maybe a nutritionist, but that's typically the end of your visit. The doctor says, I'm going to check in with you in 6 months. We're going to see how you're doing. So what are you doing? Well, like many people, before they come to see us, they're looking for answers. Patients tell us that they get on the internet, they start looking for information, and there's a lot of information out there on the internet. Some good, some not so good. Maybe you start talking to your friends or family members, trying to figure out the right thing to do. After all the websites, reading, conversations on reversing diabetes and improving diabetes, at the end of all that, people just say they end up in a state of confusion. One book would say you should have this type of diet and eat these types of foods. And then the next article would say you shouldn't have that type of diet. It's not good for diabetics. You should eat these foods. So who do you believe? You end up feeling paralyzed. And if you make some changes and take your medication as prescribed, what we see is that your body adapts to the medication, starts to get used to that dose, and then the numbers start to creep up over time. So you go back into your doctor's office for a checkup, and they run your A1C. Now, you guys should all be familiar with your hemoglobin A1C. That's the 3-month average of how you're doing controlling your sugars. According to the American Diabetes Association, their range, the American Diabetic Association range, below 5.7. Okay, if you're not on blood sugar medication and your A1C is below 5.7, you're in a non-diabetic range. 5.7 to 6.4 is pre-diabetic, and above 6.4, that's where you get into type 2 diabetic range. So you go back into your doctor, and the doctor says, oh, you're out of range again. And then what do? Yeah, they grab that prescription pad and write another prescription for more medication. So if you're on 1,000 milligrams of metformin, you're probably going to be given 2,000. So take 1,000 in the morning and 1,000 at night. And it's not what you wanted to hear. Then the doctor begins to tell you that not only did your sugars go up, but so did your cholesterol. That went up. So in conventional medicine, you know the solution when you have high cholesterol. Yeah, it's going to be another pill, the statin medication. The doctor writes another prescription, and then they tell you that when the nurse was checking your blood pressure was out of range. So what do they do for that? Conventional medicine, another prescription. So now you walk out of that office with a blood sugar, blood pressure, and a cholesterol lowering medication, which is the typical diabetic cocktail. This is what we see patients coming in on a daily basis. Not a day goes by that we don't see a patient that is on this cocktail of medication. Once again, we still have not corrected the root causes of any of those problems. Your body will adapt to the dose. Then months later, your doctor is going to check your A1C and they're going to give you more medication. If your A1C is at that range and you've maxed out on metformin, then they're going to put you on Januvia or Janumet, which is Januvia and metformin together in one pill, or glipizide. And I'm sure you heard of glipizide. You get all these pills that they're going to add trying to push that A1C number down. Remember, we still haven't corrected the underlying issues that causes it all. You may think that you're on some special cocktail of medication that's personalized and customized specifically for you. But unfortunately, we see the same medications coming into the office and the same prescription patterns coming in on a daily basis. So we call that the type 2 diabetes train. If you're diabetic or pre-diabetic, you're riding the train with the rest of the folks that are diabetic or pre-diabetic. I'm saying you're riding the train because everyone on the train is going to the same place, given the same recommendations, the same medication. It's the same treatment plan across the board for everyone. Unfortunately, we know where that train is going to lead. Some people think it won't be them. They think the train isn't taking them to the same place that's taking everyone else. In many cases, that's called denial. But the train is going to lead to more and more prescriptions and more complications. And unfortunately, your health will decline over time. And if you ride this train long enough, you're going to unfortunately reach the last stop and the last tool that the doctor has, which is insulin. All right? So the doctor is going to sit down and say, well, Mrs. Smith, I've maxed out on all the pills, right? The only thing I have left is insulin. Maybe they start long acting, but then you're put on a short acting. So you're injecting yourself as many as 4 or 5 times a day. We see patients coming in injecting that many times. Most patients don't realize that high levels of insulin are toxic to the body. They negatively affect the body. Your body, your pancreas does produce insulin, but when you get these high levels of insulin, it's going to create a ripple effect. One of the effects it's going to create is weight gain. And all this insulin influx into the body is creating more and more insulin resistance. You've heard that term before, insulin resistance. Your cells stop listening to insulin. One of insulin's main jobs is to take the sugars out of the bloodstream and get it into the cell. If you have more insulin resistance, what happens to your blood sugar? It's going to go up. Then if your blood sugar's up and you're on insulin, what's your doctor then tell you to do? That's right, inject more insulin. Then it's going to create more insulin resistance and higher sugars, and you could see how this is a vicious downward spiral. Research shows that this is what happens when your exposure to insulin goes up. Now, if you want the standard of care for diabetes, this is what it's going to look like. And this is right off the American Diabetes Association website. That's where I got this document from. It outlines the standard of care for you. You start at the top, and it flows right on down to the bottom, so you can see it's just a flow chart, cookie cutter. No one's getting treated as an individual. It's very systematic. You start at the top and you're prescribed one therapy, which is monotherapy, which is typically metformin. That's what most people are started on. And then, if you're lucky, lifestyle management, change your diet, lose weight, exercise. That's lifestyle management. If your doctor does that, they've done step 1. Then if you come back and your numbers are still high, then you get dual therapy, all right, which is adding another pill. Then maybe more lifestyle management, change your diet, weight loss, exercise. Then triple therapy, another pill, and then all the way down at the bottom is your injectables, and that's where insulin comes in. This is the outline of the standard of care, and this is what many people watching this video are receiving, or you're going to receive, okay? You can see that the goal, understand, the goal is not to help you reverse this disease. They expect your disease to progress and get worse over time rather than help you reverse or overcome it. I don't know about you, but this is not how I want to handle any problems in my life. Just manage it while it gets worse. Everyone wants to fix problems, not manage them and watch them get worse. Now, you've been told that you can't get better. Diabetes will progress and get worse over time. You're going to be on medication the rest of your life, and eventually you're going to end up on insulin. Maybe you asked your doctor, why do I have the disease? And here it's because it's genetic and you can't reverse it. There's no cure, and on and on and on. Look, I know because patients tell us, they hear all these different things. So I want you to know these things are not true. They're not true. That's not my opinion. The science does not support those ideas. Science shows that we can effectively reverse type 2 diabetes, and our approach is backed up unbelievably and extensively by research that's out there. Now, I just pulled a couple of research papers and put them into the slide, just so you can see that there's research that supports this model and this approach that we use. Now, we've developed our diabetes reversal program over the last 28 years, and it's based on scientific research that's out there, and these are just a couple of the thousands of papers that support reversing diabetes. Here's the thing, and this is going to make more sense to you than what you've been told about your diabetes so far. You have to handle the right causes. Just taking more prescriptions is not going to get you off this train. It's not. You can reverse the disease, but you have to know why you have this disease in order to know how to get rid of it. All right? In our office, we treat each diabetic as an individual. It's not a flow chart. We don't have some cookie cutter flow chart that's going to work for every type 2 diabetic. If there's 100 diabetics watching this video right now, there could be 100 different diagnoses as to why you have this disease. Now, I'm going to get into some really interesting information about how the body works and how all your systems are interconnected. I'm going to give you some insight on how everything in your body impacts sugars. Now, I have this picture up here, and it's check engine light in your car. Now, you may have seen an analogy like this before, but it's worth reviewing. And I'm going to get into these systems in a moment and how they impact blood sugar, but I want to give you a visual analogy on this. Imagine you're in your car and you're driving home from somewhere and it's dark out. It's nighttime and suddenly your check engine light starts to flash. Now, this is going to be annoying because that light is flashing in your face. And now there's one more thing on your list of things to do tomorrow. You know, you have to bring your car in to get it checked. But for every single problem, we know there can be different ways to try and solve it. We know something's going on with the car. One of the solutions for how to handle it is to simply cover the check engine light with a piece of black electrical tape. Now, what if you did that? Problem solved, right? At least it's not annoying you anymore. Out of sight, out of mind, no problem, move on, drive down the road. But what do you know about what's going on underneath the hood of that car? Doesn't make sense just to cover that up. Well, not if you care about your car, of course, right? So the same thing to do would be to bring your car into a mechanic and have them pop the hood and run some diagnostic tests and try to figure out what's going on underneath the hood. So you're given a medication to lower sugars. You're given a medication to lower cholesterol. You're given a medication to lower blood pressures, right? Mind you, without any diagnostics as to why you have the problem in the first place. Please comprehend that. Nothing is being done to find out why you have the problem in the first place. Essentially, each one of those things is like a strip of black electrical tape because they give you the medication and it hides the symptom. In the case of diabetes, it hides that annoying high A1C number from your lab work. It hides the blood sugar problem. It may lower it for a little bit, but you have not addressed or corrected why the sugars are elevated in the first place. And that is the big difference between what a functional medicine approach, what we do at our office, and what conventional approach does. We're going to look under the hood and we're going to figure out where really is the body malfunctioning, what's going on with this body, what are the causes and contributors to high blood sugar. Here's why this is so important. Research published And it was actually published back with the American Diabetes Association back in 2003, showed that aggressively trying to drive down hemoglobin A1C with multiple prescriptions, so just piling on medications. If we take 4 or 5 medications to push hemoglobin A1C down to the normal range, what they found in the study is that you were more likely to be dead within 5 years if you just tried to drive and prescribe down A1C. Many people, by the time they come to see us, they're already on 3 or even 4 oral medications for diabetes plus insulin. And their A1C is nowhere near normal because now they've got the side effects of all the medications and you've not actually handled the underlying causes of the diabetes. So I'm going to get into some of those things now, but I want you to appreciate that it's a little more involved for most people than just cutting out sugar. Obviously, cutting out sugar is a big deal and a big factor, but also doing it in a way that can be successful long term and not going on like a starvation diet or other things like that. So what I want to go through with you now is all the different systems and organs that have their hand in regulating blood sugar, so you can appreciate that this is not a disease of metformin deficiency. You aren't deficient in metformin. If there was such a thing as metformin deficiency, we'd simply be able to go pluck metformin seeds off the trees and we'd be able to eat them, right? So you're not deficient in metformin. So we're going to go organ by organ and gland by gland through this process. I'm going to get into some very general stuff, but this is vital information for you to take in. The cause of your sugar dysregulation is dependent on many different systems and organs, internal and external factors, and there's a dance and coordination between all of it. If you're a type 2 diabetic, it's not a pancreas problem. Now, sometimes your doctor tells you, oh, your pancreas just can't produce enough insulin. Well, eventually it might poop out, and then you might actually end up on insulin later in life. It's just like this whole bad future that's kind of put out in front of you. But actually, it has very little to do with the pancreas in the beginning few years. And just so you get clarification between type 1 and type 2 is not your pancreas. It's not the problem. With type 2 diabetes, your pancreas is abused into creating a lot of insulin beyond what the pancreas should be secreting throughout the day, and you're doing that to try to actually get sugars down on your own. Your body's trying to do the right thing, and this is what your pancreas is designed to do. It's not making a mistake. Now, a type 1 diabetic is different. They're actually an insulin-dependent diabetic. Their pancreas does not produce enough insulin or none at all, and so that person actually has to be given insulin to take. So type 1 is an autoimmune condition, and if you're watching this and have type 1 diabetes, you should stop this video, call our office, and have them send you the video I did on autoimmune issues, because that is much more pertinent to your condition. Okay, now a type 2 diabetic can become a type 1 diabetic later in life, in the future, if the immune system starts to attack the pancreas and destroy it, and it can do that. Many people think that type 1 is just juvenile. It's diabetes that kids get. But no, as an adult, it can happen to you. So it's very important that we rule those things out, in or out, and do the proper testing, especially if you've already been put on insulin. So let's start with the thyroid, okay? There we go. The thyroid gland is a little butterfly-shaped gland that sits right in the front of your throat. And this gland is very important. It essentially runs the metabolism of your entire body. Every single cell is dependent on thyroid hormone, and the speed at which each cell runs their processes throughout the day is dependent on thyroid hormone. If someone is producing too much thyroid hormone, their metabolism is very hyper. Everything runs faster than it should. If the thyroid is sluggish and not healthy, not producing enough thyroid hormone, then the whole metabolism shuts down. If you're in a slowdown state, your energy is going to be down. You're fatigued all the time. Your repair is going to be slow. You'll have low energy to do anything. But each one of your cells also feels that, so they're very sluggish in running their processes. So what happens is everything just kind of slows down. If your metabolism slows down, you're not burning energy efficiently, and sugar and glucose is one of the main sources of fuel for your cell. If cells all slow down, what happens to blood sugar? It's going to creep up because you're not efficient energy burner. The other thing that can creep up with thyroid deficiency is cholesterol. We often see lipid levels or cholesterol numbers going up because the body's not metabolizing things in and out of the cell very efficiently. It's one of the things that we always look for with our patients when they have elevated blood sugar or elevated cholesterol. One of the first places we look for is the thyroid markers to see, okay, is there something going on with the thyroid, because that's a very common reason for these blood sugars and blood cholesterol issues, aside from dietary reasons. So now, if you go into normal conventional doctor and they see elevated cholesterol, what do? They prescribe a cholesterol lowering medication. In many more cases than not, it's some type of statin drug. And again, you're not addressing the underlying cause, and this is very important to look at. We very closely assess thyroid function as part of our workup with a diabetic or pre-diabetic who wants to work with us for diabetes reversal, even though to most people those things don't seem connected. They really are. Now, before we look at the next thing, the next organ and gland, we need to talk about lab work. I'm told this all the time. Dr. Morris, my doctor says my labs look good. My labs are normal. My thyroid is normal, for example. We were talking about the thyroid. Yet I'm tired and I'm gaining weight and I'm depressed. Let me tell you something. Lab ranges are inaccurate. Please remember that. All right? Here is how a lab determines a range on which your doctor is basing his assessment for your care and treatment. They take the average low and the average high of whomever's been in that lab over the last year. Now I'm going to ask you, what kind of people go to the lab? Sick people or healthy people? Right, mostly sick. And is America getting sicker or healthier? Well, they're getting sicker. So lab ranges are basically based on sick people. And that's what your doctor's using. Now, we don't use standard lab ranges. Pathologists and the Endocrine Society have determined ranges that are healthy people would fall into. So from a functional medicine or root cause point of view, we have to look at optimum lab ranges, not ranges comparing you to the average sick American. So if you end up here or here, your doctor is going to say you're fine, but you could have all kinds of problems or symptoms of, and what we're talking about in the case of thyroid, an underactive thyroid, or whatever the condition may be. So in the case of, since we were talking about the thyroid, TSH, for example, it's the main thyroid lab marker most doctors use. They say 0.3, the lab says 0.3 to 5.7 is normal. So if you're at 4.2, what's your doctor going to say? He's going to say you're fine. But we know you're going to have all kinds of symptoms of underactive thyroid because you're not fine. You are fine when it comes to the average sick American that's being assessed, but you're going to have all kinds of symptoms. So we use functional ranges. So that answers the question, why do I go to the doctor? I feel so bad and my doctor tells me my labs are normal, and this fully applies not just to thyroid, but to any lab work and any lab work related to diabetes, such, kidney markers, liver, blood. Okay? So you got it on the lab work and how vital it is to have your labs assessed properly, making sure you're looking at them from a functional medicine perspective and optimum lab ranges, not your standard lab ranges. So we're going to jump into next, the adrenal glands. All right, so they're two little almond-shaped glands that sit on top of each of your kidneys, and they're tiny, but they're very powerful and very, very important. And here's a picture of them. They sit on top of your kidneys. They look like those little caps on top of each of your kidneys in this picture. Those are your adrenal glands, and they're very important in regulation of blood sugar as well as blood pressure. So if your doctor isn't looking at how your lifestyle, diet, health, etc. is affecting your adrenal glands, I promise you, you are not going to fully reverse your diabetes. These guys create a hormone called cortisol. Now, many of you have heard of melatonin, right? So melatonin is the sleep hormone, but you have a wake hormone, if you will. It's a stimulatory hormone. It's called cortisol. In the morning, cortisol should be high because it's your wake hormone, and melatonin should be low in the morning. Cortisol should be down at night, and melatonin should be high at night. This is your circadian rhythm control. It's important to keep things on rhythm. We have many, many processes and hormones in the body that have multiple jobs to do. They have multiple functions. So cortisol is your wake hormone, but one of the other things that cortisol is your anti-inflammatory hormone. The adrenals will secrete cortisol anytime there's something that causes inflammation in the system. Tissue damage, inflammation, stress, mental, emotional, physical stress can cause cortisol to be secreted as an anti-inflammatory. So if you're in pain, if you've got a lot of stress, if you're dealing with any challenge to your immune system like an infection or inflammation, things that you may or may not even know about, then cortisol could be actually high all day long. And there's an important thing to this picture and this problem. Cortisol increases blood sugar. It actually forces glucose to stay in circulation in your blood instead of in storage. So what happens if cortisol is high all the time? That's right, your blood sugar and blood glucose will be high, and it doesn't really matter what you're eating or not eating. This is one of the reasons for a frustrated patient who's really watching their diet but still can't seem to get their sugars down without medication or whatever. I think you can see why this is such an important thing to assess. And one of the things that we assess with our patients is their cortisol levels throughout an entire day. I'll tell you, most conventional doctors do not assess this. It can tell someone a tremendous amount about why their sugars might be high and where to start looking with each different patient. So imagine if your system is so jacked up with some type of inflammation or whatever that's causing you to secrete cortisol off of that circadian rhythm. What's going to happen if cortisol is high before bed instead of low? This is the person who can't sleep, can't shut their brain off. They wake up at 1, 2, or 3 in the morning and they can't easily go back to sleep. They say, I don't understand. I just can't sleep. I'm going to tell you, sleep is so critically important for gland and organ function, especially pancreas function, liver function, brain, your nervous system function, and healing. Lack of sleep is one of the biggest causes or contributors of diabetes. In fact, sleep is so important that vast amounts of research says you're at an increased risk if you sleep less than 8 hours per night of Alzheimer's, cancer, obesity, and diabetes. And these things are all interconnected. Okay, so that's the adrenal gland. Next, we're going to talk about intestinal health. I can't tell you how many people come to see us and they're having a bowel movement every 3 days or every 5 days. They have intestinal bloating. They have diarrhea, constipation. They have gas. They have cramping. They may have already been diagnosed with some type of intestinal disease like irritable bowel disorder or Crohn's or ulcerative colitis or celiac disease. But the health of your intestines is so crucial for helping people with blood sugar management. Here's the reason why. First off, your entire immune system's first line of defense is your intestinal lining, right? And what can happen over time, whether it's chronic stress or medications, foreign chemicals or toxins, or just bad food in general, over time, what can happen? Especially, like those things are going to have an impact, right? Especially things like antibiotics. Most people have had to take an antibiotic for some reason or another, but we have many patients that come in that have been on multiple rounds of antibiotics over the years because they hand them out like candy. Anytime you have a sniffle or something, it's an antibiotic. All kinds of stuff that people get antibiotics for. But unfortunately, it disrupts the bacterial balance of the intestines, and that bacterial imbalance can lead to yeast overgrowth and other types of bad bacterial overgrowth in the gut. Over time, the intestinal lining can start to become weak and actually leaky, and we call that leaky gut. If you get leaky, the gut gets leaky, then foreign food and bacteria and viruses can easily enter your bloodstream directly from the intestine when they should never, ever, ever be able to enter that way. Now, imagine you get all this stuff into your system. Now you got a major level of inflammation in the system chronically happening. And this chronic inflammation is going to drive cortisol up, which then causes your blood sugars to go up. So problems in the intestines and the health of our gut lining has to be addressed for many people in order to help them get their blood sugars reversed. So if you got some type of parasite or infection going on, an overgrowth of bacteria or yeast going on, and you've got this leaky gut situation happening, often this gets to a point where you overactivate your immune system in your intestines. 80% of your immune system is in your intestinal lining, just trying to protect you from outside stuff. And at some point, when you get leaky, you can actually start to accidentally attack food proteins as if they were a virus or some type of invader. And if you start that incorrect attack, you're now in a hyperinflammatory state, and so you can end up attacking food. And it could be a food like broccoli or almonds, for example. These are healthy foods, right? Some people change their diet and they still have jacked up sugars. It turns out when we run tests to determine if their immune system is attacking certain foods like it's a virus, we often find foods that are normally considered healthy foods that are causing their blood sugar problem. For that person, every time they eat that food, they ramp up this inflammatory reaction, and then their sugars go high. So it's not that they're eating a lot of sugar. It could be something like a vegetable or a spice. It could be black pepper. It could be anything. This is why individualized care is so important. No two people that we work with in our office, or even if they're out of state actually, has the same diet. The health of the intestines is extremely important. Got it? Okay, so next we're going to add into the discussion that we were just on about generalized inflammation. We kind of talked about the immune system issues, okay? So one of the reasons why someone has a much higher susceptibility to heart disease, stroke, liver disease, high cholesterol, high blood pressure is because a diabetic is already highly inflamed for any number of reasons under the sun. If you're already fighting a bacterial infection, if you're attacking certain foods, if you're already fighting all this stuff, if you already have elevated sugars causing damage to the system, if you're already really inflamed, then it doesn't take a whole lot to put that person right over the edge as far as other diseases are concerned. You need to know what hemoglobin A1C actually represents. That is a marker that is a percentage of your red blood cells that are damaged by blood sugar. Your red blood cells carry oxygen, so the more damage you have to your red blood cells on a continual basis, the less oxygen to your body. Your brain and nerves make up only 3% of your body weight, but consume 30 to 40% of your oxygen. So if a high percent, over 4.4% really, that's a functional range, not the 5.7% that the ADA says. A high percent of your red blood cells are continually damaged. What do you think is going to suffer the most? If you said the brain and nerves, go to the head of the class. Brain and nerve degeneration is going to happen when you have high inflammation, high blood sugar, high A1C. So that's a little update as far as that goes, but this is why it's so critically important that if you have diabetes, you work to reverse it, because reversing it will clean out the blood, calm down the inflammation, so that you can work on defending yourself against all these other diseases that are out there and potentially can affect the body. So you have to check to see what type of inflammation markers someone might have. We run many different inflammation markers that can tell us what the likely causes of the inflammation are. And again, these are markers that are not usually done when you see your doctor. And if they are done, usually those poor lab ranges are used, which we talked about earlier. We also look at white blood cell and red blood cell markers in our clinic. We actually look to see, is there a pattern of inflammation? Does it look like you have a chronic viral issue or a yeast problem or bacterial problem? Or do you have an autoimmune disease where your immune system is now so confused about what it's attacking, it actually starts to attack you? Like this is like rheumatoid arthritis, celiac disease, Hashimoto's, multiple sclerosis, on and on and on, right? All of these things are inflammation conditions that cause sugars to be high. And then unfortunately, if you have an autoimmune condition, what are you commonly prescribed for that to help lower the inflammation? Long-term steroids or corticosteroids. Cortisol and corticosteroids are kind of the same thing. Corticosteroids are just a prescription form of your natural cortisol, which is an anti-inflammatory. That's why they give it to you, right? It makes your sugars go up. Look, folks, I'm not kidding. The medication they prescribe to get inflammation down actually causes sugars to go up even more. And you just have this spiraling insanity of people coming in on an average of 10, 12, 15 different prescriptions. It gets pretty crazy. Addressing the immune system and what they could be causing the immune system to be malfunctioning is extremely important. Next thing is the liver, okay? Liver function is exceptionally important for a diabetic. The liver is actually the organ and tissue that becomes insulin resistant long before you ever get a diagnosis of diabetes. Listen, the number one cause of fatty liver is not alcohol. It's actually poor sugar regulation and diabetes. If your liver stops functioning perfectly and becomes insulin resistant, you actually lose the ability to store sugar as excess fuel in the liver, which is one of the functions of the liver. Then you just start spilling out massive amounts of glucose out into the system. The other thing is, if your liver is not doing its job perfectly and does become fattier and congested, it will not be able to eliminate toxins well. Another one of its jobs is to eliminate toxins. So toxins build up in the body, and of course, that's going to then trigger the immune system and more inflammation, which, that's right, causes sugars to go up further. So addressing liver function is absolutely critical to helping someone get long-term success at reversing their diabetes. So here's a picture of where the liver is. It's kind of tucked up underneath your rib cage on the right area there. Now, many people have had their gallbladder removed, right? If you've had your gallbladder removed, you're more likely to become diabetic because now you're not actually able to absorb and digest fats the same way. But you'll have no problem getting sugar into the bloodstream from the foods that you're eating. Dietary fats get blamed a lot for what sugar has done. Fat is critical for brain and nerve function and all of your cell membrane function, which happens to be where your insulin receptors are on your cell membranes. So you can start to see that it's extremely important that you maintain a healthy liver. And if you don't have a healthy liver, we get it healthy. And again, I'll refer you to what I said earlier as to why your doctor hasn't looked for this or gone over this with you. The system is set up for prescribing you medications, not fixing the problem, okay? So now the most important is your brain and the pituitary gland, okay? So you know where your brain is. This is Top Gun here, right? The brain regulates everything underneath it, either directly right through nerve conduction or indirectly through all these glands that we've been talking about, through hormones, right? Those are two main ways your brain communicates with the rest of the body: nerve signals and certain hormones. If the brain is not functioning well, how good of a job are you going to do at regulating blood sugar? You're not going to be regulating the pancreas very well if your brain's not working. You're not going to be regulating the adrenal glands, the liver, none of it, right? There's another important thing. You're being put on medications that negatively impacts brain and nerve function, which ultimately over time can actually worsen or contribute to the worsening of this disease, the diabetes. Here's what I mean. We know that most diabetics are put on some type of cholesterol medication, right? Well, cholesterol is the way that your body actually transfers fat from your blood safely through the bloodstream to your brain and your nerves. Now, you might not know this, but your brain is 70% cholesterol, and the protective covering on your nerves is almost 100% cholesterol. So you get put on a statin medication, and I'll have to put you on it whether your cholesterol is high or not, because you're a diabetic and a higher risk of cardiovascular disease. The problem is that if you ever check the side effects of statin meds, they actually contribute to brain fog, memory loss, neuropathy, things like that. Neuropathy is the death and dying of the nerves. As I said, those nerves are coated in thick, fatty cholesterol sheaths that allow the nerves to conduct signals appropriately. So not only does the diabetes clog those blood vessels and destroy those blood vessels and red blood cells that feed those little nerves, but if you're on a cholesterol drug, you start to starve the nerves in the brain of the fat that they need. Now, you've probably already heard that one of the most common complications of diabetes is neuropathy. We have so many patients that are then put on neuropathy medication like gabapentin. And I don't want to get started on the horrors of gabapentin. We'll be here for hours. if you have numbness and tingling in your feet or your hands, if you have neuropathy in your feet or your hands, you for sure have brain degeneration, neuropathy of your brain. Your brain gets damaged too. One of the common contributing factors to Alzheimer's, dementia, and other neurodegenerative diseases is elevated blood glucose and insulin resistance. So, this is super important. There are actually markers that we look at to assess how the brain is functioning as well. We might have to do something with the patient to support their pituitary gland and other regulatory glands to make sure everything is moving and functioning well. So I hope you can see how everything is connected. Now, of course, we're also then going to have to look at and see how well and assess your pancreas, okay? Because like I said, some people think that they're a type 2 diabetic, but something happened to them in their journey of life, and now their pancreas is starting to shut down, or it's being destroyed by the immune system, or there's some type of infection, and ultimately you could be a type 1 and a type 2 at the same time, believe it or not. We do see people in the office that are both. Both would be type 2, the type 2 insulin resistance of the cells, not listening to insulin and with elevated blood sugar, and then type 1 is the loss of the pancreas function. They actually have a name for it. It's called diabetes type 1.5, if you can believe that, or LADA. This is latent autoimmune diabetes in adults. It's a very recognized condition. It's not tested for very often in conventional offices, but for us, in our attempt to figure out why someone's sugars are out of control and they're not able to reverse their diabetes, we have to assess pancreas function. We got to rule that in or out as a possible cause. So just repeating, we definitely are trying to get people off of cholesterol medication because of negative impacts on the brain and nerves. Another interesting thing about metformin, it actually contributes to accelerated brain and nerve degeneration. I'm not saying that to tell, I'm not making that up. This has been noted in a lot of research over time. What happens is you can become deficient in very important vitamins because of the medication that the brain and nervous system requires to function properly. Metformin is also damaging to your liver. So if you're on metformin and you're on it for many years, eventually the sugars start to creep up because you become so deficient in these nutrients that your brain and nervous system and your liver need. It's obviously our goal ultimately to help people reduce and eliminate their medications and actually reverse their diabetes, reverse their sugars into a normal range. We want to get cholesterol into normal range. Cholesterol responds very quickly to our protocols. Even if you've been told your cholesterol is high due to genetics, we oftentimes are able to get that down significantly. It's also a very important thing to know that these medications with long-term use, the cholesterol medication, has been found in research to contribute to poor sugar regulation. This means even a person who's not diabetic, if they're put on cholesterol medication, they're statistically more likely to become a diabetic because of the statin drug. It contributes to all this other dysfunction that over time causes sugars to go up. So this is a very important information and data. These are drugs that people are put on and they're just expected to stay on them for the rest of their life, and they wonder why they just get worse and worse and worse. Well, this is why. So in order for us to actually reverse diabetes, we have to look at everything. We have to figure this out for each individual person because no one is the same. What are the big issues that are contributing to the blood sugars being high for that person? What are the multiple causes that they have? I'm sure now that you can appreciate that it's not just measuring your A1C and take a drug to lower your sugars and your A1C. That's not a long-term solution. That does not actually reverse this disease, and it doesn't address any of the reasons why the sugars might be high in the first place. Any of them. I want to cover a couple more things before I end off, and things that we hear over and over and over again. Okay? Doctors tell patients every year on their visits that they have to change their diet, lose weight, and exercise, and then the doctors walk out. Look, folks, the patients a lot of times, they don't even really understand what that means. I mean, they understand the words, but they don't know what that means. This is where a lot of people have gone off on their own. You've tried this diet, that diet, and that diet. Look, there's no one diet fits all for everybody. You could be reacting to certain foods There could be certain things in your diet that are causing a lot of inflammation for you that it's not affecting somebody else. Some person could be more sensitive to certain vegetables than another person. There's just no one diet fits all, as you can see. We just talked about this, and it's why we say that the general recommendations, the conventional recommendations usually given, are a guaranteed way to actually keep weight on and keep your diabetes. We've seen what the diabetes educators hand out in the doctor's offices, in the group classes. They're all essentially encouraging people to stay diabetic. I know that sounds strange, but I'm telling you, those diets are oftentimes a way to keep your diabetes. It's all about managing your diabetes. They say you can still eat X, Y, and Z food. Just adjust your insulin up accordingly, which hopefully you can see now is ridiculous. That's how you actually make things worse, folks. Then you're told you have to go lose weight. And again, here's the problem with that concept. It insinuates that you're a diabetic because you're fat. Just so you know, we have type 2 diabetics that are skinny as a rail. Their diabetes is not caused by weight. The diabetes can cause the weight gain because after the liver, the second tissue group that's insulin resistant is your muscle, not your fat cells. If your sugars are elevated and your insulin is elevated, you're going to push sugars into fat if you can't get sugars into your muscle. So it can be the diabetes that's the cause, not the fact that you might be fat. Look, we've had patients prior to coming to us go off to join the gym. Prior to ever seeing this, go off and join the gym. They change their diet. They lose 50 pounds. And they still end up on insulin because their sugars were still high. For some people, it's just not that way. Other patients say, well, I'm already exercising. I walk every day for 30 minutes, or I go to the gym for 30 minutes every day. I do my workout class at home or whatever. They're told, you got to exercise more. You've got to exercise more. And what is exercise to the body? Well, believe it or not, it is a physical stress, right? The physical stress can cause cortisol to go up. Research equivocally shows that intense exercise for more than 45 minutes actually raises cortisol, which then will cause sugars to go up. Some of our patients exercise at the gym 2 hours a day. They're cycling all the time outside for hours and hours, hundreds of miles a week. And it turns out they had to end up on insulin and their sugars got bad and their A1C went crazy after years of doing this. You can actually end up, if you're extremely stressed internally, you can have something like exercise drive up elevated sugars. And every time your sugars go up for any reason, even excess exercise, it's a ding to the system. The system cannot handle chronically elevated blood sugar. It worsens the insulin resistance, and so sometimes we have to dial a patient back from too much exercise for a period of time to help get their system in a better state to be able to tolerate that exercise before they can go back to it without it impacting their sugars negatively. So another thing, you get told it's genetic. We said that earlier. You can't do anything about your genetics, so just take your medication. It's your mom's fault, blah, blah, blah. Folks, this just takes a lot of your power out of your hands, right? It's genetic. Well, then God programmed me to be this way, so there's nothing I can do. You just have to accept it, take my medication, just kind of mope through life. Well, I have to let you know, and maybe some people don't want to hear this, but this is absolutely false. Look, we do some genetic testing with people when it's warranted in the office, but what we're seeing and what the research shows equivocally is genetics is just a potential. Your genetic material can be interpreted and read differently depending on the environment. Your genetics express in different ways. Genes can be turned on and they can be turned off. So while someone may be genetically more prone to becoming a type 1 diabetic or type 2 diabetic, this doesn't mean you will become one, and it doesn't mean that after you become one, you cannot work to reverse the diabetes. I hate it when people are just blankly told it's genetic. And no one even did any genetic testing on them in the first place to determine if that was the case or not. They just say it's genetic. Look, I hear that about cholesterol all the time. It's genetic, and they never did a genetic test. Look, there's no way that half the population of this country is pre-diabetic or diabetic due to a genetic cause. It would literally mean that God totally programmed all of us just for full-on diabetes. It's an external thing. It's a lifestyle thing. It's a chemical exposure thing. It's a toxin thing. There is something causing the genes to not act right, but when you correct the environment internally and externally, the genes express themselves in an appropriate way. And I just want to let you know that that just because half your family might be diabetic, honestly, it doesn't mean that everyone has to have diabetes. This is an important factor. Please take your power back. We reverse diabetes every day. I hope I didn't overwhelm you with all that. I'm trying to cover a good outline of all this while trying to keep it pretty simple. But I do hope you can appreciate the complexity of the disease that you might have. And this is why that 5 to 10 minute visit once or twice a year with your conventional doctor, this is why you're not going to get to the bottom of any of this stuff. Half the time the visits are literally like, okay, we just need to update your prescriptions. I don't even honestly know if they're always looking at your blood work and what labs are they even running. So look, one would have to look at each individual diabetic and would have to dig into their case and figure out what is the cause of this problem for them. So you've got to run tests. I think you got the idea. We're going to have to look at the adrenals, the liver, all these things. We've got to run tests to look at all these things that we've talked about today. And many of these are specialty tests. So it's a good question that usually comes up here. Does your insurance pay for all these special tests? No, they don't. Should you care? I don't think so. Insurance is a pharmaceutically based system, and you might have to stop thinking that you have to follow your insurance-based model. There's the old definition of insanity. Keep doing the same thing over and over and expect a different result. If you're out there and you're watching this and you're sick and tired and you're not enjoying life and you're rightly worried about the future, then look, you got one trip around this thing we call life. One trip. I'm 52. I got a lot to live for. I enjoy my life, but I'm pretty healthy. You have to ask yourself right now, is this the way I want to live the rest of my years? You have to see value in yourself. You have options. That's the purpose of me taking time out to make this video. If your doctor's not figuring it out, then come to see us or someone like us to figure it out and get your life back. You know, the other day I was out and about and I saw this guy, and he had to be at least 500 pounds. He was probably around my age. He's walking into a store, and I was filled with compassion. I was thinking, this guy, geez, living in his body must be like living in a prison. And I'm not sure which would be worse. Now, I don't say that to be condescending or to cause someone to feel bad about their condition, but it occurred to me that it can feel like a trap to have your health go so far south. Look, if your body's not working like it should be, then you need to do something different. You need to find out why. And if your doctor is not finding out why, then that is what we do here. So if what I've gone over makes sense, I'm going to show you what to do. What's the next step you need to do to take to get your life back? But you've got to do the testing to figure yourself out and know what is causing the problem. You know, there's an interesting fact here. They did a survey, a study, and they found that the average doctor is between 13 and 17 years behind on current medical literature. Not our providers. They're always studying. They love this stuff. And it's not just our philosophy. It's in the scientific literature. But most doctors don't know it because they're 13 to 17 years behind. They're busy running a practice. They have to see so many patients in order to keep their doors open and pay their staff, add in their family time. There's so much out there to know about it, but you've got to act on it. So we do the proper testing to find out. Do you have food sensitivities? Do you have a parasite? It can't begin to tell you how many diabetes patients we've treated that have had parasites in their gut or other problems in their gut. We have to do testing for unstable blood sugar and, again, food sensitivities. So once you clear this up, it's like a light bulb going off. You start to feel better. You start losing weight. You start getting your energy back. And these are things that are not being checked for typically. And if you think about it, why would your doctor check for those if his system or her system is a pharmaceutically driven system? Look, no pharmaceutical company has a vested interest in finding a solution for your problem that isn't pharmaceutical in nature. I'm not being a conspiracy theorist here. That's just the way it is, okay? So now we've covered some of the common areas, but we didn't even touch on all of them because this video would be another couple hours. But when we start to address the causes, then we're able to see patients that reduce and eliminate medication. They lose weight without exercise, okay? They have normal blood sugar, normal A1C, more energy. We see neuropathy reverse. Actually, nerves can regenerate. I don't care what you've been told, the science shows they can regenerate. We see patients on a regular basis that have had that happen. We see patients that improve their kidney function. They improve their vision. At the end of the day, they get their life back. And they know the things that they need to do to maintain these results. So I hope you got some great information over the last 60 minutes or so. So now, what's next? Please understand this. Knowing something and not doing anything about it is just like not knowing it. You need to take action. My team cannot help you unless you call us and make an appointment. If you want off this train, the next stop is our office, okay? If you want to come in, I'm going to go over what we do here. If you want to come in, we're going to schedule you for 2 visits, okay? We schedule you for 2 visits, and here's what we're going to do on the first 2 visits. So when you call, they're going to send you, my staff is going to send you, first off, they're going to say, did you watch this video in its entirety? We will not see anybody that until they've watched this video or have seen us give a class on this information, because we don't have time to explain all this in the office. We're busy. Someone cannot just come in and say, hey, I understand your office manages diabetes cases. That won't work. They got to know what we do. They're going to end up saying things like, this is all great. I got to go talk to my doctor about it, even though their doctor hasn't fixed it in the last 20 years. So we don't have time to explain all this one-on-one. That's why I make these videos. When you call the office to make an appointment, they're going to mail or email you some very important paperwork for you to fill out prior to the first appointment. So at that first visit, we're going to do an exam. We want you to bring your spouse or significant other. We need them to understand what's going on. You need them to understand what's going on. You got to understand, if you're watching this alone without your spouse or significant other, this is affecting them. And you need to realize that. And they need to see that there are options out there for you. So on visit number 2, we're going to let you know if we can accept your case. We can't accept every case, but we're going to let you know if we can accept your case. So what do I mean by that? Some people come to us and they're like, I don't want to make any lifestyle changes. I'm not going to make any changes. Just fix me. That's okay, folks. You can be that way. But don't come see us if you have that attitude. We won't accept a patient with that sort of attitude towards their own health. I'm going to tell you right now, you'll waste our time. And more importantly, your time and your money. You've got to have the attitude like, you know what? I'm sick and tired of being sick and tired, and I want answers, and I'm not getting the answers, and what you say makes sense. If this doesn't make sense to you, that's totally fine. But respectfully, we are likely not the right place for you. So on visit 2, we're going to go over any and all further testing you will need to do. All right. We're going to overview your treatment plan. Most of our diabetes patients are managed in our office for 9 to 12 months. Usually after 12 months, you don't need us anymore. We'll have it figured out for you. We'll teach you how to stay healthy. This is a teaching program. There's an old adage that says you can give a person a fish and feed him for a day, or you can teach him how to fish and feed himself for a lifetime. Nothing pleases our team more than to run into a patient we haven't seen for years, and they're out and about, and we hug and we cry or whatever, we high five, and then tell us how good they're doing. Tell us how good they feel and how their life is better. That makes all the work that we do worthwhile. The stuff that we do is not easy. It's taken our team thousands of hours of postgraduate studies and thousands of hours of independent study to learn all this. And this is the benefit you're getting when you come to see an office like ours. So we're going to overview your treatment plan. A lot of people want to know, how often do you need to see me? Folks, that varies, but typically a patient is going to come see us once a week or every other week. Very hands-on. We're going to overview the financial obligation. What is it going to cost you? I'm going to give you that information in a few minutes. On that visit, we also need your spouse or significant other. Why? Because we're going to go over what's wrong. We're going to go what it's going to take to get you better. And that emotional subject, we're going to go over what it's going to cost. Okay? Your spouse or significant other needs to be there for that. We like to be transparent, and you should come in already having a pretty good idea on what it's going to cost, because I'm going to go over it here in just a moment. So it shouldn't be a surprise to you. But to recap, what you need for your first appointment, you need your paperwork filled out completely. If you come in and we've reserved an hour for you and you don't have the paperwork filled out, we might not have time to see you. We've got a busy practice. We do everything we can to run on time, and you filling out the paperwork on our couch will eat into that time. You'll be happier if you use your couch at home to fill it out ahead of time. And we need your spouse or significant other at that first appointment. If your spouse is involved in any way, shape, or form in your health and your decisions, then we need them here to be at this appointment with you. It just works that much better that way. Okay, same on that day, on that second visit. Spouse needs to be there. We're going to review all that information. So we can accept 10 new diabetes patients per month. We do not jam up the schedule, leaving the provider team no time to see and help you. All right. So our patient load is limited, so we can give the best care possible. The cost of those first 2 visits is $550. If you make an appointment after watching this video, then that $550 is reduced to $175. Okay, so it's $175 for the first 2 visits total. It's for both of them, not individual. Now, we do have some rules, all right? So our 3 rules, I want to be very clear, all right? You got to be willing to make serious life changes. Something's got to change. If you keep doing the same thing over and over and over, but expect different results, you're going to go insane. I know that's been happening to some of you. You just don't know what to do. That's what people hire us for. When you do what we recommend, it will work because it's not guesswork. It's going to be based on what we see in the lab work and on the testing. So you've got to be willing to make some changes in your life, folks. It's just the way it is. Please don't shoot the messenger. It's just a fact. You have to take accountability for your health. You can't blame your parents, your spouse, your kids, or the president. It's you. And once we teach you, then it's up to you. Now, we do accept insurance in our office, but insurance, I'm going to say this very clearly, insurance does not cover root cause or functional medicine. And I mentioned why earlier in this video, if you recall. So don't come in saying, I hope my insurance covers this. It will not. But I'm going to give you a rough guideline on the cost. A typical treatment program ranges between $7,000 and $10,000. In many cases, we can offer an 18-month payment plan. But if it's not worth $400 to $700 per month for 18 months, we usually see patients for 9 to 12 months. You're not under care for 18 months. You're under care for 9 to 12 months, but we can stretch out the payment plan. If it's not worth $400 to $700 per month to you, potentially interest-free for 18 months, then we might not be the place for you. I don't like surprises when it comes to spending money, and people tell us all the time that they really appreciate the transparency here. So I'm giving you a rough idea of what it costs. $7,000 to $10,000 and between $400 and $700 a month. Now, many patients pay for it all up front, and they get a pretty decent discount if they do that. We'll go over exactly what your care is going to cost you on your second visit. You're under no obligation. You can do whatever makes sense. But it does have to make sense. I tell people all the time, I believe this in my heart, I do not want to be in the convincing business. I don't want to sell somebody in this type of care. They have to want to get better. We can almost always make this work for someone that really wants to get well. Also, I refuse to let our staff drag someone through their care. Our patients have to want to do the work that is needed. Now, you should ask yourself, on a scale of 1 to 10, how serious is your illness? What you have is a chronic disease. They don't get better on their own. They only get worse. Where do you see yourself in 1 to 3 years from now? Look, due to time constraints, we can only accept those who are truly committed to their health. You'll be amazed at how healthy you can get once you go to someone who truly understands the underlying causes and addresses them. So I hope this makes sense. If you're watching this and you're really ready to make a change in your life, call our office, make an appointment. Let's get started. We hope to see you soon.